Hi everyone, we're here at Sunset Dermatology and we're really happy that you've joined us today. We have myself, Dr. Perez Quintairos, and Monica Ponce, our physician assistant. So what is RHA? RHA is actually a relatively new hyaluronic acid on the market that has some special qualities. It lasts about 15 months. And it is a product that has been specially designed for the areas of the face that move, especially the nasolabial folds and these marionette lines. When you smile, it actually moves with the face and the muscles. The product itself is special also in the sense that it has not been altered very much. It's very similar to the hyaluronic acid that we have within our body. So it's an excellent product to use for special areas. So we brought RHA into the practice because it really fits well within our practice. It's a product that emphasizes the natural look. It moves with the body, it moves with your expression. So it gives a very, very nice natural look to the face and the injected areas.
Hi, I'm Monica Ponce. I'm one of the physician assistants here at Sunset Dermatology, and I'm very excited that we're adding the family of fillers, the RHA fillers, to our line here in the office. One of the questions that I get asked often is, where can I use RHA fillers? The beauty of these products is that they're used for areas of movement. So they can be put almost anywhere in the face. You can put it in any fold that you would like to fill in, any area that we need to lift up or volumize. They're beautiful for the lips because we're moving and talking and animating a lot in those areas. So really, they're fillers that can be used in almost every area of the face. So there's really very few patients that are not going to be good candidates for this filler. These fillers are fillers that, because they have 3 different fillers in their line, we can pick and choose where we're going to put them. Some are a little bit thicker than others, so it's easy to be able to put them in different areas of the face. So really, it's hard to find a patient who would not be a good candidate for these fillers. So typically these fillers last about 15 months or so. Some patients get a little bit more longevity out of the products, and usually this happens when we do more than one filler. So sometimes we'll do different areas of the face, and that does help to get a little bit more length of time out of the products also. As with any filler, afterwards you'll have some swelling and possibly some bruising. There are certain things we can do beforehand to see if we can reduce the chances of those, like taking arnica or decreasing your consumption of wine and not taking aspirin or ibuprofen beforehand. Usually the swelling will last a few days, and the bruising also, in some cases, it may last a little bit longer, especially if we did a few fillers at the same time. Patients can expect to see their final results at about 3 or 4 weeks after their treatment. When we use hyaluronic acid fillers, you'll see the immediate results right after we're done, but there will be a little bit of swelling. So we like to wait about 3 to 4 weeks so that we can finally see what those final beautiful results will look like. Hi, I'm Monica Ponce. I'm one of the PAs here at Sunset Dermatology, and today I'm going to be doing lip fillers on my patient. In this particular case, I've chosen to do RHA2, and the reason for that is because this patient is not interested in a lot of volume for her lips. She's looking to see if we can basically give her back the lip that she had from 10 years ago. Normally, as we age and when we enter our 40s and our 50s, we start to see that we're losing a little bit of our natural volume. So that's why I picked RHA2 for this. It's a great filler to use in the lips, and it's a great one for somebody who just wants to augment a little bit of what they have and give them a little bit more plumpness without making it look unnatural. So we're ready to go. Here we go. So there's different techniques that we can also use. In this particular case, because what we're trying to go for, little tiny pinch, what we're trying to go for is not overly volumizing her. What we're going to do is, I like the fanning technique for this. You can also use different entry points, but this I feel is the best technique for what she is trying to accomplish. We always try to make sure that we specify and kind of customize our treatment depending on what the patient is looking for. So you can see that I've only used a little bit of my syringe, and already you can see a nice difference from side to side. Lips tend to be a more sensitive area, but we try to make it easier for the patient by using numbing cream beforehand, usually for about half an hour, maybe a little bit longer for some patients. We also have different techniques that we can use, like vibration devices if we need. The product does have lidocaine in it, so usually by the time that we do the first few little pinches, it's a lot more tolerable. Okay, so we're almost done here. We're already finished with the left side and the top of the right side. And then we just have this little piece left and we're all done. So you can use, in the lips, you can use needles like I'm using now, or you can also use a cannula. I happen to be more of a fan of a needle. In the lip, I feel like I have a little bit more control this way, but it really is just a matter of preference. The lips is an area that will have swelling. So I usually tell patients, 2 or 3 days, and the swelling should be almost completely gone. Sometimes you can have some bruising, even though here I don't think we're gonna have very much bruising. But anytime you have a filler, bruising is one of those things that can happen. So I think that we're all done here, and we've accomplished exactly what she wanted. So we have a nice amount of volume without being overly done, and she just looks a little bit plumper and a little bit more of a refreshed, like she has more of a refreshed lip and a refreshed appearance. She already has a tiny bit of swelling, more than anything because of the lidocaine in the product, but I think in about 3 days or so, she's gonna absolutely love her lips.
All right, so Rosa, we're gonna start by doing the deeper filler first, as we spoke, and we're gonna do it in this area here, and then we'll move on to the nasolabial fold, and we'll do the area around the lips last, okay? So we're gonna go for the first pinch. Ready, set, pinch. And this one's to give a little bit of support to the outside portion of the lip, the lateral portion of the lip. Can I have a cotton tip applicator? And slow injections. That actually is one of the things that we do in order to avoid one of the complications that we see in fillers, which is we don't want to get any of the product inside any vessel. Okay, let me grab that cotton tip applicator, thank you. So we put a little tiny bit in. I am now massaging any little elevation down, trying to get it as smooth and as even as possible. This little bit of support to the outside portion of the lip is very important, especially in women as we start to age. We lose that support, and the lateral part of the lip, we start to lose that a little bit. So we're giving that part a little volume, a little strength, a little resilience. And we're pretty much at close to half of the syringe now. I have to watch my volume. You can already see a little difference between the two sides. We are going to go for the few little things that I feel we've got left here that still need the deeper volume. Like I said, this one's RHA 4. That has a bit more body, if we want to put it nice and simple, a bit more body than the other products that we're going to be using. All right, RHA 3 now. They're all color coded, which makes it easy for us to know which one we have in our hands.
Okay.
I'm going to start up here in the corner of the nose, and we're going to work our way down. That first little pinch hurts a little bit more, so just
Yeah.
so you can. You're a great patient. Okay, so here we go. Ready, set, pinch. And again, we'll go very, very slow. This product is excellent for these areas because these areas move a lot. They have a lot of movement. Obviously, expression, smiling, crying, excited, they all move this area. And this area moves in many different directions, depending on what the emotion is. So these products, one of their advantages is they move with the face. They move with the motions. They are very, very pliable, let's say. With this same RHA 3, we're just going to keep going. Small little amounts. If I put a large bolus, a large amount, sometimes it's noticeable. So I'm not a fan of doing that. Just a bunch of small injections, and always checking where we are to make sure that it's looking good. So here's a little layering here at what we call the oral commissure, which is the corner of the mouth. One product on top of the other gives us a better result. Still have a little bit of an indentation in this portion.